the dementia, cognitive impairment, and neurological disorders. The global population is aging at an unprecedented rate, with more people living longer thanks to advances in healthcare, nutrition, and overall quality of life. While this is cause for celebration, it also presents new challenges. One such challenge is the rising prevalence of dementia, a group of neurological disorders that severely impair cognitive function. Dementia affects millions of people worldwide, with Alzheimer's disease being the most common. As life expectancy increases, the number of people living with dementia is expected to increase dramatically. According to the World Health Organization, the number of people with dementia is expected to increase from 55 million in 2020 to 139 million in 2050. The surge in dementia cases presents a significant public health challenge, as the disease not only affects the person diagnosed with dementia, but also places a considerable burden on families, healthcare systems, and society at large. The importance of dementia prevention and care cannot be overstated. Early preventive measures can significantly reduce the risk of developing dementia, while effective care strategies can improve the quality of life of patients. Additionally, caregivers play a vital role in supporting patients as the disease progresses, which can be both gratifying and exhausting. Dementia is not a single disease, but a syndrome, a group of symptoms associated with a decline in memory, thinking, behavior, and the ability to perform daily activities. While people often think of dementia as a natural part of aging, this is not the case. It is caused by a variety of diseases and conditions that affect the brain, leading to a gradual deterioration in cognitive function. There are several types of dementia, each with its own characteristics and potential causes. The most common types include Alzheimer's disease, the most common form of dementia, accounting for 70 to 80% of cases. It is characterized by the accumulation of amyloid plaques and tau tangles in the brain, leading to brain cell death and loss of cognitive function. Vascular dementia. This is the second most common form of dementia and is caused by a decrease in blood flow to the brain, usually after a stroke or multiple mini-strokes. This type of dementia is associated with problems with thinking, planning, and concentration. Lewy body dementia. This dementia is caused by abnormal deposits of a protein called alpha-synuclein in the brain and is known to cause fluctuations in cognitive function, hallucinations, and sleep disturbances. It can cause changes in personality, behavior, and language. Mixed dementia. In some cases, a person may have two or more dementias at the same time. For example, Alzheimer's disease and vascular dementia often occur together, complicating diagnosis and treatment. Dementia usually develops in stages, but the rate of progression and specific symptoms vary from person to person. Stages are usually divided into. In the early stages, symptoms are often subtle and can be mistaken for normal aging. Common symptoms include mild forgetfulness, difficulty finding words, and mild personality changes. The patient may still be able to move independently, but may sometimes need help with complex tasks. As dementia progresses, cognitive decline becomes more pronounced. Memory loss worsens, and the patient may have difficulty completing daily tasks, such as dressing, preparing meals, and managing finances. Behavioral changes, such as restlessness, aggression, and confusion, become more pronounced. Supervision and assistance are often required during this stage. In the severe stage, the patient loses the ability to communicate effectively, recognize loved ones, and perform basic activities of daily living. They may be bedridden, require around-the-clock care, and are highly susceptible to illnesses such as pneumonia. Care at this stage is often focused on comfort and quality of life. Understanding the risk factors for dementia is essential to developing effective prevention strategies. While some risk factors, such as age and genetics, cannot be changed, Others are related to lifestyle and health conditions and can be addressed with proactive measures. The most important risk factor for dementia is age. The risk of developing dementia increases significantly after age 60, and the prevalence doubles every 5 years thereafter. Family history plays a role in the risk of developing some types of dementia, especially Alzheimer's disease. Specific genes have been associated with an increased risk of Alzheimer's disease. However, having a genetic predisposition does not guarantee that a person will develop the disease. Conditions that affect the heart and blood vessels, such as high blood pressure, diabetes, and high cholesterol, are associated with an increased risk of vascular dementia and Alzheimer's disease. Maintaining good cardiovascular health through diet, exercise, and medical management can reduce this risk. Smoking, excessive alcohol consumption, physical inactivity, and a poor diet are important risk factors for dementia. These behaviors contribute to the development of conditions such as obesity, high blood pressure, and diabetes, which in turn increase the risk of cognitive decline. People with higher levels of education and lifelong learning activities are thought to have greater cognitive reserve, which may help delay the onset of dementia symptoms. Participating in intellectually stimulating activities, such as reading and learning new skills, can also promote this cognitive reserve. Preventing dementia is a complex and multifaceted challenge that requires proactive interventions as early as possible. While it may not be possible to prevent all cases of dementia, research suggests that changes in lifestyle, cognitive engagement, and social interaction can significantly reduce the risk of dementia. Social interaction is another key factor in maintaining cognitive health. Research shows that people who maintain good social relationships and participate in regular social activities have a lower risk of dementia. Social engagement provides mental stimulation, emotional support, and a sense of belonging, all of which are necessary for overall health.